Good morning. It is October 28th, 2025. My name is Deanna Diamore. This is the October Board of Health meeting. Present, we have Board of Health members Frank Ehrlich, Ken Lalim, Norman Weinberger, Anthony Santella, and Joan McNeil. We also have Health Department staff members Aniela Fignon, Teresa Argandesi, Kelly Tomlinson, and Brian Weeks. First item on the agenda is the acceptance of the minutes. Do I have a motion to approve the special meeting October 7th, 2025 meeting minutes?
So moved.
Norman first. Do I have a second?
Second.
Okay. I think Ken or Frank, either one, can say it at the same time. Thank you. Any comments, any edits, suggestions? All right, hearing none, I'll take a vote. All those in favor say aye.
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 Any abstentions? Any nays? All right, they pass. Thank you very much. Next item is public participation. I am checking the attendees and I don't see anybody. So we will open and close public participation. And then next we have our performance management annual analysis. So we're gonna have Aniela give a recap of our performance management analysis over the past year. We have a packed agenda and we have several divisions and measures, so we're going to split this into two. So she's going to do the first half this month and she's going to do the next half in November. So Aniela, take it away. Good morning.
Thank you, Deanna. And good morning, everyone. It's good to see you all. Hope you can all see my screen now. So as Deanna said, we are going to split this into two. So we're not going to talk about the entire, annual analysis today, but we are going to go through most of the process for it and talk about a couple of divisions. So get your questions ready for the end. So just as a refresher, our performance management system is in place to monitor the quality of performance of public health processes, programs, interventions, and other activities, improve public health practice, and ultimately improve the health of Norwalk residents. It is an iterative strategic process where we set performance standards to improve or ensure maintenance of desired outcomes. So that's goal setting, figuring out what we want to see ourselves perform and what goals we want to meet throughout the year. Throughout the year, we do measure our performance based on those carefully crafted metrics. Sometimes we tweak those metrics if we think that it's a better reflection if we change the language. And we report on that progress quarterly. So all of our supervisors have a dashboard for their divisions where they quarterly report on these metrics and then on an annual basis do so as well. We use this data to make improvements, sometimes with deliberate QI methods, other times we make tweaks throughout the year based on what we're seeing with the data. And then sometimes we just use the performance management system to kind of change those goals year after year to push us further and further. So again, this is all about developing those objectives and measures, carrying out the processes that we need to gather the data, looking at that data, analyzing whether there are any opportunities for improvement, implementing those as needed, and then reiterating the entire process to continue to continuously improve our department. So it's just a quick visual of what our dashboard system looks like for our performance management. So this is the way that we organize ourselves. Every division has a dashboard where we set out a goal for the division, or for here, you're seeing the Office of the Director. There's an assigned supervisor who is responsible for making sure that the dashboard is entirely filled out each quarter. Is key to indicate when people should be actually reporting on their metrics. And then we have a list of objectives for each division. As you can see on the left, there are 5, prescribed objectives for the Office of the Director. And so what you'll find in the dashboard is that there's a domain for every objective. That domain has measures that speak to the objective. And we set targets for each of those measures, goals that we'd like to see ourselves reach throughout the year. We track those, the data, what we actually accomplish. We give ourselves a little status so that we can check on, where we are throughout the year really easily with a color-coded system. And then we have performance narratives in place. So for every measure, we can explain how we reached the goal, why we reached the goal, whether there were challenges or barriers, or if we exceeded our goal, why we met that goal with such flourish. The second part of our dashboard is something that we've fleshed out over the last couple of years. So we have definitions and details for every measure. Basically, we want to describe what is being measured and how, and provide a description of why it is important for us to be measuring that particular activity. Our process for completing the annual analysis is pretty standardized at this point. So the division is going to self-reflect on performance with the support of the project coordinator, which you guys all know is me, to identify successes, challenges, and opportunities for improvement. So every year, what I do is I put together a template for each division that is tailored to the division with its annual data finalized and all the appropriate measures pre-inserted so that it's very easy for supervisors to respond. When I say supervisors, I should clarify that it is really supervisors and their teams. This is something that the entire department works on, and it's looking at performance goals for the entire department and not individuals. So it really is a team effort. So then the supervisor and team develop brief sentence narratives for each of those measures and provide context for the data. Again, sort of those, why did we reach the goal? What were the challenges? What were the barriers? All of that information so that we can tell a holistic story about our department and our performance. The supervisors and their teams detail opportunities for improvement, and I support that, as well as the next steps. And then in the end, what I do is I summarize all of the conversations and the distillation of all of that into a dashboard revision. So we talk about what goals we want to see in the next dashboard for the next fiscal year. So today we're going to take a look at 4 of our divisions, or 3 divisions in the Office of the Director. So it's going to be Community Health, Epidemiology, us as the Office of the Director, and then Preventable Diseases. Just a quick reminder that our key indicates that dark green, so the big successes are 95% of the target was met or greater. Light green is between 85% and 95%. Yellow is between 70 and 85%. And red is 70% of the target or less. The last option that we have is a gray category, and that means that for some reason, something didn't get measured or the data was insufficient throughout the year. So diving right into one of our star divisions, Community Health, they had a lot of achievements this year, and so it was hard to choose which things to include, but things that I thought were really awesome were that they conducted more than 150 outreach events or instances. Those were health promotion program sessions, health screenings, like for programs like Know Your Numbers, trainings for partners and residents. So things like QPR, which is question, persuade, refer, to prevent suicides, and other various community events and tabling sessions. In our Growing Gardens program, all 10 of the families that participated responded to the program survey, reporting that they actually had increased fruit and vegetable consumption, which is the purpose of the program. So it's really exciting to see that the programs that Community Health is putting in place are really meeting the mark in terms of outcomes. When we think about active transportation, we have a lot of NORWalker activities and related activities. Jalea Green and a number of our other staff members, are big outreach supporters in the Community Health Division. And so we were excited to see that 256 clients actually attended events where NORWalker activities were happening or information about active transportation was shared. So kudos to the team on that one. And then lastly, one of the achievements that I wanted to highlight is that there was an increase in follow-up call success rates at Know Your Number screenings with the aid of a bilingual community health worker. So last year, this was actually a measure that we had in place. This is something that we discussed, as their team and with me as a support. And they said that they wanted to readdress this issue, but add a community health worker with that bilingual skill set to support the program, and we saw an improvement. So that is really exciting. Some of the things that they would like to do in the upcoming year is to develop a more sustainable community engagement structure. That's just to make sure that we are continuing to engage all of the residents and lived experiences here in Norwalk. to make sure that our programs and services respond to what they are asking for. They also plan to improve their Fit Kids program evaluation to make sure that kids who are, participating in the program are understanding the content as best as possible. So they're kind of tweaking that evaluation to make sure that they're asking kids and not just their teachers. And then they are also going to continue building partnerships and investing in screenings through Know Your Numbers. Epidemiology and informatics, another one of our newer divisions, but another shining star. So you can see a lot of kind of 100% things under the achievement section here. So 100% of infectious disease follow-ups were completed for enteric, COVID-19, HCV, and other communicable diseases. And 100% of eligible clients from all of those calls and other calls were referred to services or linked to care. And there was all of that follow-up provided. So that's really great to see. Over 35 actually, presentations were delivered to committees, boards, community groups, and others covering communicable disease, public health informatics, and other topics. And the EPI team really was the community health assessment team. So that's a combination of our epidemiology and informatics division and our community health team and a couple of other folks built and implemented the community health and well-being profile, the first version with 2.0 in the works. And then we were really excited that as part of our workforce development plan, we've started to comprehensively streamline a number of our trainings and to make sure that we are responding to identified staff training needs. And so this division delivered Microsoft Outlook and Teams refresher trainings to our staff to make sure that we're all on the same page as those operations and applications continue to evolve. In terms of opportunities, we want to make sure that we are reinvigorating and continuing to reinvigorate our infectious disease follow-up with existing staffing, especially given the funding and staffing gaps. Something that we've talked about and that this division is very focused on is identifying workforce capacity solutions, potentially via long-term and capable interns to offset staffing shortages. And lastly, something that is a really big opportunity here, and it's probably no surprise to anyone, is that this division hopes to advocate for and seek funding for epidemiological and informatics needs. Moving on to our preventable diseases and clinical services division, another one of our divisions where you're going to see lots of 100% and great numbers. So right off the bat, 100% of patients that were seen and diagnosed with any one or more of major reportable STIs received appropriate treatment. 100% of patients diagnosed with active TB and for whom treatment was ordered participated in their DOT, that's direct observation therapy, as per the standards of care. And here's some exciting numbers. I know that you guys got to have that great presentation from Pam Bates last meeting. But vaccine compliance in the Norwalk catchment area ranked #1 in the state at 94% for the 2022 cohort, meaning that 1,641 out of 1,742 children completed age-appropriate immunization by their second birthday. And then for the Danbury catchment area, which our team also oversees, they ranked #2 in the entire state at 88.2% for the 2022 cohort, with 1,418 out of 1,608 children completing their age-appropriate immunizations by their second birthday. So we have a rock star IAP team. And then our WIC team, which, we have a fully staffed WIC team, 4 full-time individuals engaged in 18 outreach events, which is really exciting. Means that we are getting new pregnant mothers and just new eligible patients and clients through the door. So big applause for our WIC team on that front. Opportunities in this division are, our IAPs. Yeah.
Danielle, oh, sorry. Ken, I think has a question.
Oh,
Yeah,
I'm so sorry.
It's okay. How many patients did we manage that had TB?
So for active TB, it's usually about 1 to 2 patients per year. I would have to look back and see what the number is. For latent TB, it's a larger number. And I would also need to check in with Darlene Hoffler, our supervisor of clinical services, to get those numbers. But again, for active TB, Norwalk sees about 1 to 2 cases per year.
Thank you.
Thank you, Deanna. Back to opportunities. Our IAP staff, they're really overperforming. They have amazing rates, as we just discussed, in terms of their achievements. And so something that we need to think about as a department is how to consider our sustainability of those outcomes as our staff prepares to retire in future years, or, you know, if there's a loss of the department for any reason. So that's something that we need to think about. In terms of our clinical services, we discussed a potential QI project, a time study meant to identify clinical time spent on each activity. And then we wanted to think about a method for sharing patient results as well. So we have a couple of opportunities for improvement in our preventable diseases area. Lastly, sexual health and WIC programs consistently have met their performance goals. So, for example, that 100% of the patients seen and diagnosed with any one or more of the major reportable STIs receiving appropriate treatment. That number and that target, we've met that consistently year after year. And it's similar with our WIC measures. And so we are in the process of brainstorming new meaningful measures so that we can continue to track their work and make sure that it's, you know, continuously improving while recognizing that they are already meeting that very high bar that is set for them already. And lastly, I'm going to talk about the Office of the Director. So that is where Deanna sits, myself, and Catalina Mosquera, our Public Health Program Associate. So the achievements that we had this year were that we had 12 Board of Health meetings. Thank you all for attending. Just wanted to highlight the contribution that you guys have made. We also successfully completed 2 quality improvement projects. So they went through full project cycles, and luckily they were project cycles that wrapped up the entire project. But those 2 projects were focused on grants filing and creating a standardized system for saving all of our grants materials, and flu clinic attendance and standard operating procedures for our staffing structure. Our QI work group participated in training with the Public Health Foundation to build QI project team skills, and that was really exciting. We got great feedback from everyone. We have a lot of folks who feel much more prepared to lead QI project teams at this point. We also developed a reaccreditation preparation tracking tool and implemented that throughout the year with reaccreditation documentation leads who are preparing all of our documentation for our 2027 reaccreditation application. And we also branded and formatted 3 emergency plans in consistency in alignment with our new brand guide. Excuse me. Our opportunities for improvements. So one thing that we thought about is our annual report, which is an internal sort of annual report on things that you know, our department successfully completes throughout the year. And so we thought about plotting letter from the director topics ahead of time to kind of get that out and to our staff in a more timely basis. We also want to consider implementing evaluations for staff trainings on a regular basis. And we also want to solicit opportunities for improvement, so potential project proposals from staff after completion of performance management and annual analysis. So through this process, all of the divisions have been working to identify potential QI project opportunities. Some of the next steps for these divisions are right here. So for the community health division, they want to nurture a sustainable community engagement structure, as we talked about, to kind of get some more voices in the room and make sure that we have a sustainable system for bringing in those voices. The EPI division is looking to complete the Norwalk Community Health and Wellbeing Profile 2.0. So as I mentioned, that division in concert with Community Health worked on version 1.0, but they are now working on 2.0. So that is very exciting. Epidemiology also hopes to develop a health department data informatics strategic plan and roadmap, and to conduct staff technology trainings throughout the year, potentially at all staff meetings or training days. In our preventable diseases division, looking at our WIC program, we hope to track first trimester enrollment for WIC clients in hopes of seeing a correlation between outreach efforts and such enrollment. And then in the Office of the Director, we're hoping to use, or we are really not hoping, we are already using our documentation spreadsheet to track the percentage of requirements completed for reaccreditation in 2027. We're working with one of our interns to brand and format all emergency plans with accessible headings and subheadings. So big shout out to her. Thank you so much for all that help. And we are also exploring a rapid QI project opportunity to reduce the turnaround time for completion of the annual report. So the next step in all of this is to consider our performance measures for the next year. So just as a quick overview, this is the process for doing so. Changes to the dashboard are discussed and identified with the division supervisor, division staff, and the project coordinator. So over the past month and a half or so, we've been having discussions about what to include in these fiscal year 25-26 dashboards. I put together the dashboard based on those new measures. The supervisor and the team review them, develop them further, and they revise definitions and details for each measure. Again, what are we actually measuring and why is it important for us to measure it? And then our Director of Health, Deanna, reviews our final draft dashboards, and I make any final edits for us to deploy and use for the year. When we are updating performance measures, there are a number of key considerations. So making sure that we're not just pulling things out of thin air. We ask ourselves, does the measure align with any of our important plans or other mandates, like the Community Health Improvement Plan or our CHIP, our QI plan, our strategic plan, our workforce development plan, grant deliverables, or other federal, state, or local mandates? We ask ourselves, does the measure create an extra lift? So is it an activity that we're already engaged in, or is it an activity that we would need to implement and add to our bucket of work? We ask what the purpose of collecting the data is and how easy it is for us to actually get that data, and who would collect and report the data. So, how reasonable and feasible is it for us to have this as a goal? Revising our dashboard means that we remove measures that are related to activities that have become standard operations, oftentimes because our performance management system has encouraged improved outcomes. We make sure that our measures that are included in the dashboard are capturing meaningful data, right? So, not things that are just tracking numbers for the sake of tracking numbers, but outcomes. It means that we have reduced retroactive data collection, so more efficiency. And there's improved alignment between each of the division's staff capacity and the required measures. Lastly, we place a bigger focus on activities mandated by grants, plans, regulations, things like that, because that is, where we get a number of our required deliverables. In terms of new measures for the year, here are a couple of examples from the divisions that we talked about today. So in community health for Growing Gardens, they are going to add a measure that looks at the percentage of children from the Growing Gardens program reporting increased fruit and vegetable consumption. So in general, we've done this for families, but this time we're going to look at children specifically and what they report. Fit Kids, that division is going to be looking at the percentage of staff reporting that students learn the importance of healthy eating for their overall health and well-being. So again, sort of working with staff to make sure that kids really understand that information. In the EPI division, they are going to be completing the Norwalk Community Health and Wellbeing Profile 2.0, which is a big undertaking. In preventable diseases and clinical services, our WIC team, which we mentioned, has met its measures year after year on a consistent basis, is going to be looking at the percent of clients enrolling in their first trimester. The point is that they really want to see a connection between the outreach activities that they're conducting and increase, hopefully, in enrollment. And then lastly, in the Office of the Director, we talked about staff trainings. So we added a measure, percent of staff trainings identified by staff as valuable. And the idea here is that we want to make sure that all of the trainings and content that we're providing to staff really does align with what they need, so that we're not providing anything superfluous or adding work to their bucket for no reason. We want to make sure that everything has meaning and value for them. And that's it for today. So I want to stop now and ask if anyone has any questions. Anthony.
Thank you for sharing this, and congratulations everyone for their, I noticed right away the dark green was dominated the those four categories of performance. I was curious about the growing gardens and the getting evaluation directly from the children and how receptive parents have been or you anticipate being to collect, directly from their kids.
Thank you. That's a great question. So I don't work directly with the Growing Gardens program. That's the Community Health Division. And I believe that this is a new measure that they're considering implementing or that they plan to implement in the next iteration or season of the program. But Teresa's online and I'm gonna just pass it on to her for an answer.
Sure, yeah. So Aniela's correct. We're looking to incorporate this next year into the program. But this subset is we have a long-running program at Fodor Farm that's all the families, and a lot of the kids are too young even to do an evaluation. But this year we piloted a new cohort at the Colonial Village Learning Center. And so that's more of like an after-school summer camp type cohort. And so there's teachers there and tutors. And so we do the gardening portion with the kids and the parents. I'm sorry, the teachers will be able to assist with the pre screening and a post evaluation. So we're still working out the details for how the implementation will go, but we are going to model it similarly to the Fit Kids program, which is a similar age group and has a lot of similar themes around nutrition and physical activity.
Okay, cool. Thank you.
Sure.
Any other questions? Awesome.
Thank you,
all.
Aniela. Thank you to the team. And Ken, we'll get you your answer to your question after we follow with Darlene.
Just slight, I know there's a lot of work and effort and things have to get done both on the front end and as ongoing with TB cases, depending on where and what group is targeted. So I appreciate that.
Yeah. I know like patient visits, we typically can have up to like over 400 patient visits for latent TB every year, but like I have to check with Darlene, like what's the unique patient like that's visits, but how many patients are we seeing, over the course of a year. So I'll follow up with her.
And who's aware of that? I mean, I don't know if the community awareness would be very interesting along those lines.
Mm-hmm. Great. Thank you, Aniela. Thanks everyone for all their really great work throughout the year. All right. Next on the agenda, we have Teresa here to give an overview about all the great efforts over the past year, kind of building on what Aniela started to highlight on health department outreach.
Thanks, Deanna. I'm going to share my screen. There. Okay. So just gonna verify and ask if people are seeing the PowerPoint presentation.
I am not.
It's starting to load. It says you've started it, but we haven't seen it yet.
Okay. I just got a notice.
I can try pulling it up too if you want, Teresa.
Can you hear me?
Yeah.
We can
Yep.
hear you, but I can't see you.
I can see your camera, Teresa. I just can't see the shared screen. It's like the black Teresa Argondesi has started screen sharing.
Okay, let me.
Do you want one of us to try pulling it up?
Let me try one more time and see. It said my internet connection was unstable, so that could be a problem either way. Still got a black screen.
Disable your camera too, if you can.
Good idea.
I'm seeing the same thing as last time where it's the black screen where it says that Teresa started screen sharing. Double click to enter full screen mode, but nothing else.
Okay, I give
Let
up.
me-
Maybe Deanna, if you
yeah,
or if somebody
let
else
me-
has the presentation.
Yeah, let me try.
That's what I get
Hopefully-
for coming into the office for a reliable internet connection. See, look at that. Thanks. So yes, as Deanna mentioned, I'm just going to give a quick update on our outreach activities. This is for the whole department. A lot of these activities are community health staff, but the whole department does this work. So tried to compile the information from everybody in every division. So community outreach, as you all know, is a big part of what we do. It provides accurate and reliable health information to community members. It helps to connect people to community resources and services. So often we get questions or requests for services that maybe we don't provide, but we can connect people to our community partners who do. We promote health department programs and services. So to your point of letting people know everything that the health department does. We also are looking for feedback from residents and community members as we're out in the community. But really one of the biggest purposes of our outreach work is to build trust in the community. We're going out of the building to the community members where they are, to places that they go to and that they trust. To be a presence in the community and let people see us and talk to us and find out, what all the great things that the health department does. Next slide. So last fiscal year, according to our our outreach tracker, we conducted or attended 186 different outreach activities. That adds up to 430 event hours. So that does not include setup or breakdown, and it does not include if multiple staff attended. This is just the total number of hours those events took. And we ask staff to estimate approximately how many people they worked with or engaged with or who attended those events. And so the approximate number there is 4,726 in last fiscal year. Next slide, please. So there's lots of different types of outreach that we do and that we track over the course of the year. So in last fiscal year, this total of 186 included 87 health fairs or information tables, 22 health screening sessions, 31 health information sessions or trainings, 44 health promotion program sessions, so things like Fit Kids and Growing Gardens, each session of those we count, and then 2 community engagement sessions where we're really just focused on getting feedback from the community. And so, as Aniela pointed out in performance management, that last bullet is an area that we're looking to improve in this current fiscal year. Important to note that this tracker does not include presentations like this one to the Board of Health or to our external community partners. This is really those activities that are focused on meeting community members and residents out in the community. Next slide, please. And so where are we? We're leaving the health department. Where are we going to do this outreach? And so it was approximately 36 or so different locations throughout the community, maybe a little bit more, but they included parks and public spaces like Fodor Farm, Calf Pasture Beach, Veterans Park, the Town Green, the Norwalk River Valley Trail, and both of the Norwalk Public Library branches. Schools, CT State College in Norwalk has emerged as a big partner. We do a lot of work with them. And then lots of Norwalk public schools, including McMahon and Norwalk High, elementary schools like Brookside, Fox Run, Jefferson, Merrimack, and South Norwalk Elementary School. Food sites like Person to Person, Open Door, a couple farmers markets throughout the city, and the mobile food distributions that happen at Ben Franklin School a couple times a month. early care and education, including Carousel Preschool, Room to Grow, Stepping Stones, some of those fun sites. We also do a lot of outreach at healthcare providers, so Circle Care Center, Day Street and Norwalk Community Health Centers, Norwalk Hospital, Notre Dame Rehab Center. So we've done different information sessions and tabling sessions there as well. Senior serving organizations like Kingsway Senior Housing, Ludlow Commons, and the Norwalk Senior Center. Faith-based organizations like St. Joseph, St. Ladislaus, and the United Congregational Church. And then lots more like American Legion Post 12, Triangle Community Center, the fire department, the police department, and City Hall as well. And that's probably just actually maybe an underreporting of the different locations we've been to throughout. Next slide. And then we've also done a,
This is Ken. I have a quick question.
yeah, sure.
Question. If you're going to cover this somewhere else, that's fine. With whether related to what's going on right now on the federal side of our world as it changes, do we have information for the community? Do we plan on educating the community? Are we not part of that, or?
Is there something specific, Ken, a specific topic in that area, or just in general as things happen and change, do we provide that information?
There's some general, but I think there's potentially education that is out there, just making it available. You don't have to be the teacher, but I think providing some of the assets that we have as a community health center, the development process. Just want to make sure that people get what they need to make some tough decisions coming down the line.
Yeah, absolutely. So it helps that we have so many different partners in the community. And so, as I mentioned, often when we're providing information about a changing landscape, whether it's food programs or access to healthcare or other things that might be happening at the federal or even state level, we're often referring people to our partners, or we're checking with our partners to review messaging, to help people understand next steps. And so a couple examples of that. So the short answer is yes, but a couple examples include at the end of the summer, this summer, when we were told by Norwalk Public Schools that there was a chance that universal school meals would have to end this year. We immediately, went into outreach mode and started working with our partners. And at every community outreach event that we went to, we brought information about how to apply for free and reduced lunch meals and to prepare for having to pay for school meals. That did not end up thankfully happening, and the schools are able to continue to provide free meals. But Ken, you're right. When something newsworthy happens, there's a policy change, there's a procedure change that we need the community to know about. Like, this is what is happening. This is how it impacts you, and here's where to go for resources and assistance. We mobilize internally and with our external partners to bring that information to the public.
Thanks. There's some difficult things coming in the way of the patients in this system.
Yeah, absolutely. Frank, I see your hand up.
Yes, I should have said this at the beginning slide where you put down the number of people reached. I would wonder if you could add to that number the percentage of possible people reached. I think that percentage number is extremely meaningful in showing the amount of work your team does to get the information out. It's much more meaningful to me than the absolute number is, just as a note.
That's a great point. Thank you, Frank. And so, just as we're putting this into the context of all of the work that the health department does, that's the number of people that attend the in-person events that we're at. And so that's folks that are coming to health fairs, folks that are enrolled in our programs out in the community, people that are coming to events like bike walk and roll to school, those kinds of events where we're there, the health department is present, they see us, we interact with them. That's attendance at those kinds of events. We're also reaching people, as you can see on this slide, through external communications. And then there's also the people that are coming to our health department for services that are getting information and education during that. And then, you know, as I mentioned earlier, that's not including the education that we're doing to partners who then it's almost like secondary outreach, who are then providing that information to the public as well. So that number on the first slide, we can definitely talk about. I mean, the percentage might be the entire population of Norwalk, you know, would be the denominator, or even of the region, but it really is dependent on who are coming to some of these events as well.
Yeah, that's exactly what I was thinking, is that you could make it either the total population of Norwalk or divide Norwalk's regions up, make it as a percentage of the region. I think there's some further information you can provide.
That's a great point. Thank you. And then you can see on the slide here, we have a little bit of a summary of our external communications, an area that we're always working to improve as well. And that is the end of my presentation.
I had a question too, Teresa. What do you consider a community engagement event? The other ones I understood, but that one I was a little unsure.
Yeah, no, it's a important distinction that we're making all the time. So the way we define it and phrase it is the outreach is when we're out there kind of pushing information to the public. And we are getting feedback, and we're getting, you know, we're interacting with the community and hearing back from them on what they need. But a community engagement event is something that is specifically designed to have the public talking more than we are, right? So whether it's a focus group, intercept interviews, on the street, you know, surveying. And so it's really, the whole purpose is to get feedback from the community and to get community voice. Not that that's not happening in those other activities as well, but the whole purpose of whatever those two things that we counted as community engagement, the sole purpose is for feedback from the community, if that makes sense.
Yep. Okay, cool.
Thanks.
Joan, did you have a question?
I do. Teresa and Aniela, great presentations. Teresa, just a quick question. How do you determine which organizations you do community events? Is it by invitation or?
That's a great question, Joan. We do we do a lot of monitoring of what's going on. So sometimes we're invited directly. Sometimes we hear of an event going on. We reach out to the organizers to find out if they're having vendors table or community partners table. Sometimes it's not that kind of an event. But anytime we think there's going to be a good amount of foot traffic, or the folks that we're really trying to reach are going to be attending that kind of event, we'll reach out if we have staff available to attend. Sometimes there are annual events that happen all the time, or activities that happen all the time. We are in the process of looking at, you know, the length of time we're spending, how many people we're reaching, and is there any opportunity to find other events either at certain times of the year or in certain locations where we can reach more people.
Oh, excellent. Because I've been to a number of events around the city, especially over the summertime, and there's always a health department table there. So, you know, so good job. Excellent job. Yeah.
Thank you. We try really hard, and we're very grateful that we are able to build up the community health division and that other divisions are able to carve out that time, right? Because again, the people that are attending are also the people who are delivering the programs and delivering the services in the health department. And so sometimes it can be hard to carve out that time, but we find that it's really important. Joan, to your point of like, we want people to always see the health department at events like this.
Absolutely. Yeah. Thank you.
This is Ken. I think where I was in on a focus piece was the SNAP benefits that are.
Yep.
Any change from we're going to blow you up as of Wednesday, you know?
No, there aren't. The current information from the state is that there will be no additional benefits starting November 1st if the government shutdown remains in effect. We did get one new piece of information over the weekend that we got confirmation that existing benefits would still be usable after November 1st. So if folks have accumulated benefits and they're either collecting them for use at the holidays or they just have some left over at the end of the month, they can roll over and the retail piece will not be turned off on November 1st. Originally, there had been some concern that any existing benefits on their cards would not be usable. So that was one good piece of information. But again, we've mobilized our food agencies. We lead an organization. Kelly leads an organization called the Norwalk Food Alliance, which is all of our food agencies and food serving organizations come together. We had a meeting actually the morning after the first announcement about the shutdown and stoppage came through, and we discussed, what the role of the Food Alliance and the health department would be. We are working with the city to put information out to the community, both on social media and in in-person interactions. And we're actually working on some messaging right now to encourage residents to support their local pantries at this time, since demand will likely increase.
Thanks
I'll
so much.
just-
I knew that you'd be involved.
I only want to add one thing. The governor did announce yesterday that the state is investing $3 million in emergency funding to the Connecticut Food Share to address the crisis. So just wanted to add that as well. The governor and the state is supporting the pantries in Connecticut Food Share. Okay, thank you, Teresa. I know we were wondering if you all would be interested, if the board would be interested in having these types of updates more frequently, like these outreach, because as Teresa is tracking it as part of her performance management dashboard, we'd be interested in having these updates like quarterly throughout the year or once a year, or wanted to see what you all thought.
I personally think more is better, but I tend to do that. I think quarterly would be great to keep an update. Gives you an idea of what's moving in the right direction, or if you make a decision on a new policy, what might be the implementation of that, and you can see it sooner if you wait. If you wait a year to measure something, you probably didn't really measure it. So I would say quarterly would be great.
Well, you're measuring it more often. Are you asking just reporting it back here or doing the work?
She's
Yeah, both.
measuring it. Yeah, we're asking you how often you want to hear these updates, reporting it. Yeah.
But you're collecting it, you're looking at this quarterly. You're just asking us how often you want us to come back here, right? Yeah.
Yes.
Okay. I was just asking that because I don't want to, propose something that's going to give you more work to do, because I know how labor intensive not only collecting the data is, but reporting it out like this. Or maybe it's select indicators every quarter. So it's, because it'd be too much to do the whole thing. I'm indifferent to it.
Thanks, Anthony. Thanks, Ken.
That kind of stuff is fine with me. If we know what we're measuring, and then we're just reporting out on the outcomes of that, maybe it's only having to document or report on those things that are in not taking an active role in the process. So we can report less, get more bang for your buck.
Thanks, Ken. Thanks, Teresa. All right, so we're at 8:50 and we have 2 more presentations. Are you all able to stay on for a little bit longer after 9?
Yes.
Yes, I should for a bit, yes.
Okay, thank you. All right, Kelly is up next. She's going to give an update on the Norwalk Suicide Prevention Grant.
Good morning, everybody. Deanna, thank you for inviting me to share the work we're doing with our public health approach to suicide prevention grant. Let me share my screen. Are you seeing the full slide or the note?
We see the full slide.
Whole
Awesome.
slide.
All right, I'm getting the hang of my multiple screens here. And so I presented last year on the work that we're doing as part of this grant that we received back in 2023. So this is just kind of an update and continuation of the work that we continue to do. Aniela and Teresa touched on a little bit of the components in both of their presentations, and so I thank you for mentioning it. And please let me know if you have any questions as we move forward. And so just a quick roadmap of how kind of where we are and where we're going. Back in 2022, the State Department of Public Health had approached us to see if we were interested in a grant opportunity that took a public health approach to suicide prevention. It was for local health departments, and we were chosen due to some of the higher rates of suicide in our area. And so we said yes, that we would take this on, and we kind of started to see what partners were out there as we started to work on getting the contracts in place. The grant was signed and funding became available for this first grant year in July of 2023, and we've been working steadily since on the grant program. The grant ended August 31st of this year, but we got news that we were extended for another year. And so we are working, we're thrilled to be able to continue the work that we're doing with our partners in this field. And so just to kind of highlight the different deliverables that are in the grant and the work that we're doing within them. And so the first one is really participation on committees, advisory boards, and partnerships, and working together, convening partners, leading initiatives, and kind of helping them with what they're doing. And so you can see the full list of here of all the partners that we've kind of worked with and collaborated with along the way. The ones in bright purple are ones that are new to us over this past year. And so we've been working closely with the parking authority to place 988 Lifeline signage up in the parking garages in Norwalk. We've been working very closely with CT State, the used to be called NCC. We've been doing fresh check days with them. I'm going right after this to do a suicide prevention training. They've been wonderful partners with us along the way. Sono Collection, very similarly, we are working with to put signage in their parking garage for 988. Zero Suicide Institute was another, it's a national partner that works on a zero suicide framework for healthcare providers. And we had worked with them this year to have a workshop done with our healthcare providers. And then the Connecticut Center for School Safety had asked us to do a presentation at their regional conference on our postvention plan. The second deliverable that part of this grant is looking at our inventory and gaps analysis for local suicide prevention resources, policies, partners. And so we partner each year with UConn to hold this inventory. This past year, we were able to inventory 10 of our partners. We were able to do 9 last year, so we continue to grow. And this year it was identified that Norwalk is rich in training opportunities around suicide prevention, treatment and therapy services, support groups. Our postvention plan and our team is going strong. We have some amazing partner groups, and then screening and treatment policies that more and more places are starting to put together. We then also use this opportunity to look at what was missing, so this gap analysis with UConn. And so we continue to look at upstream factors, what things, from this public health approach or this larger population community level place, how can we really look at upstream factors to prevent suicides or prevent suicide ideation from happening in the first place. We want to continue to build partnerships with our healthcare providers, really strengthening that partnership, creating or promoting programming aimed at helping at-risk populations. And so the grant had identified individuals from pretty much 10 up to 65 with the missing 35 to 44, but understanding that those in the LGBTQ population, veterans, postpartum women, really do have high risk rates of suicide or suicide ideation or attempts. And so really, how can we look at what is available to help promote or get resources out to those communities? And then increasing signage at these high risk areas. In addition, we took it upon ourselves to do a healthcare provider survey to really better understand ourselves what was happening in our pediatricians' offices, our hospitals, our healthcare settings around suicide risk assessment and their treatment practices. And so we were able to screen 9 providers last year, and 89 of them, so 8 of the 9, did screen for suicide risk at initial intake. And a lot of the treatment referrals, including 911, 211, and then our local behavioral health and counseling services. However, few referred to youth urgent care centers, mainly because there are not a lot in our area, but not a lot of providers were referring to peer-led support groups, which we have plenty of. And so working within the things we're finding to address that this year. Our postvention plan, and so I mentioned in our presentation last year that it was the first time that the city had documented a postvention plan. Not to say the work was not being done. We have an incredible team of partners that you can see here that were already doing the work. Postvention is something that takes place in the wake of a death by suicide to really help support those directly impacted heal from grief, get services that they need, and kind of connect them to care. And so a lot of this work was being done. We just really kind of put everyone at the same table and documented that work into a plan that everyone can follow. And so we have our police department, our hospital staff and EMS, we have representatives from our public schools, community services, we have our human services department as well as the health department, and then some of our behavioral health providers, Positive Directions, Mid-Fairfield, and Family and Children's. This year, we took it a step further and translated all our materials into Spanish. So we have our resource guide, our consent form, our needs assessment. We then, in addition to the suicide loss resource guide, we have one for grief and loss for those that are struggling with loss of someone from an untimely death. And then we started making quick reference guides. So based on the needs assessment, if someone selected yes, we wanted to make sure that we had resources in hand that we can quickly refer to and give them those resources. Another piece of the work that we continue to do kind of in the background is data surveillance and monitoring. So it's really using the local and state data we have available to us to track trends in mental health, suicide ideation, suicide attempts, and deaths by suicide. It helps us kind of look at what is happening here locally in Norwalk, but then also what is happening trend-wise on a state level and sometimes a national level. And it also helps assist us in evaluating some of the local initiatives that we're doing. And so the health department has the ability to access the Epicenter surveillance system to look at emergency department data. We get quarterly updates from DPH's VDRS, or the Violent Death Reporting System. Our partners have really been wonderful with the Norwalk Youth Survey. Each year or every other year, they survey our middle school and high schoolers to get information on a realm of behavioral health things, but mental health is one of them. This year, the city also partnered with NPS and our behavioral health partners to do a gap analysis around mental health services for youth. And that hopefully in the upcoming year will turn into a strategic plan on how the city can come together to help address mental health for youth. We also lean on the Trevor Project, which is the U.S. National Survey on Mental Health of LGBTQ plus young people, and then the Norwalk Partnerships Community Conversations. The next piece, which ties into kind of what Aniela and Teresa were talking about, but this is really about leading or participating in these local suicide prevention, intervention, and response, called SPIR for short, strategies and activities. And these are the trainings, the conferences we attend, the presentations we do, programming that we offer, and outreach events that we attend. And so very briefly, this past year, we've done applied suicide intervention skills training. And so ASSIST for short, it's a 2-day long intensive training that works mostly with providers or clinicians to really help gain skills. It's very interactive, but the skills needed to counsel someone or help someone going through a suicide ideation. And so from the time we started our grant in 2023, we were able to hold 3 trainings and get 51 clinicians and community partners trained in this. We also partnered with the Norwalk Partnership and Positive Directions, as well as our regional behavioral partner, Catalyst CT, or the Hub, to do an overdose prevention and Narcan training as part of statewide Save a Life Day. and we were able to train 29 people. Question, persuade, refer. So QPR, this is a community helper training. It's available to anyone and everyone. It's really helpful to just learn the warning signs and that come with someone thinking or struggling with suicidal thoughts. How to kind of have that conversation, ask that question, persuade that someone that life's worth living, and start referring them to the local resources in our area. We were able to get 2 of our staff members trained in QPR. And since that time, we've been able to hold 29 trainings and get 499 participants trained overall in this. Counseling on access to lethal means is another suicide prevention training. This is kind of a step up from QPR, but not as intense as the assist that I was just sharing. But really, it talks a lot about, same thing, identifying those warning signs, but how can we help someone plan for safety and look into what access to lethal means, such as medications or firearms that they have, and how can we help them temporarily remove them or keep them safe until we can get, the person that help. So again, we were able to have 2 staff trained in CALM. I apologize for the typo there. We held 6 trainings, and we were able to train 216 community providers, but as residents as well. And so coming up, we have a bunch of trainings coming up just within the next 2 months. And so we are partnering with DC State, like I said, to hold 3 QPR trainings for their students and their staff. We'll be going to Norwalk Community Health Center, school-based health center staff to offer the CALM training. We're going to Norwalk Hospital to train their outpatient staff on QPR. We're partnering with community partners to offer QPR to all of the Norwalk Public Schools, middle school and high school staff as part of their professional development day. And then we were going to Catholic Charities to also offer QPR. So we have a lot of community opportunities coming up to offer these trainings out to the public and get the word out. I'm not sure why this is. There we go. And so I mentioned Zero Suicide briefly as part of one of the partnerships we had just recently developed. And so this was the staff training that we held. It was on just a couple months ago. We had 9 healthcare organizations attend. This was a really big success for us. We tried for probably since we got the grant to really bring in healthcare partners into the suicide prevention work. And to work as, taking a public health approach, which is not often, always so clinical. And so it took a couple of years, but we were able to finally build those relationships enough to gain momentum. And it kind of accumulated into this event where we had, the 9 healthcare organizations attend. We had our hospital partners. We had both of our federally qualified health centers. The VA came, Circle Care, Human Services Council. We had EMS support there, our hospitals, as well as our clinical staff. We had 23 participants trained, and the attendance ranged from chief medical officers and executive directors all the way down to nursing staff, front end staff. So it was really a holistic way to think about how can we implement suicide prevention strategies across an entire healthcare system. Conferences and presentations. And so we had the opportunity to present our postvention plan at the Western Connecticut School Safety Conference for continued learning and just to see what else is out there through the state. We attended the Connecticut Suicide Prevention Conference. And we partnered with our friends at Family and Children's based on a request to speak to both staff and residents of Kingsway about mental health considerations when living with our neighbors. We also had the opportunity, NACCHO put out a request for local health departments working with suicide prevention to be part of a new module that they were doing for their NACCHO University. And so for the community-based suicide prevention for local health departments, we applied and got selected to speak upon 2 modules that they were doing for part of this training. And so we were able to speak upon our postvention plan, but then also really the power of working with so many partners and how health departments can really leverage the opportunities that they have of having kind of their hands in so many different sectors across the community, and how can we really use our role to be a convener or a facilitator to bring those partners together to streamline services, break down silos, and really help one another to help our residents with suicide prevention overall. And so it was a really wonderful opportunity that we were selected to be a part of. Very briefly, just a couple of the programming and outreach events we were able to attend. So we are on the planning team and a participant in the Norwalk for Mental Health Walk and Wellness Fair. Fresh Check Day at CT State. It's a big mental health fair where each vendor is asked to take on a activity. So we did one around gratitude where we had over about 65 to 70 participants come and do an activity at our table that was writing their own gratitude or positivity cards. It was a really wonderful event that we were glad to be a part of. We had the opportunity to go to both the main branch and the Sono branch of the Norwalk Public Libraries to offer Gizmo, which is a child's guide to mental health. It follows kind of this dog Gizmo through his learning how to work through mental health, understanding that thoughts, feelings, and behaviors for children can help improve mental health, and what are some things that you can do to help that. And then it also goes a lot into trusted adults and who can you talk to about your feelings. And then lastly, it's really getting the word out around for resources in the area. We have a webpage dedicated to mental health and suicide prevention resources that people can call upon. We've been making different types of media for 988, which is the National Suicide and Crisis Lifeline. So we have bookmarks, we have cards, that things to put on the back of your phone. We have keychains, business cards. So anything that you can think of to really get the word out there for 988. Around lethal mean access, we have ways to practice firearm safety and safe storage. We hand them out at outreach events, but we also have gone to firearm dealers in the area and are working with the firing range to see if we can put them up in there as well. We work to really get the word out about safe medication disposals. We have the postcards that highlight the medication drop box at the police department. We have Deterra bags here that we give out as often as we can so that to dispose of medication from the safety of your home. And then I talked briefly about the at-risk populations. And so we've been making resource guides specific to these individuals. So for example, this Women's for Mental Health event or Women's for Mental Health resource guide. Lastly, each September, we partner to put ads at the different train stations to really highlight 988. So this was this year's campaign. It was placed at the East Norwalk train station, the South Norwalk train station, the Rowayton train station. We also did some social media campaigns around Break the Silence. We put those up in September for Suicide Prevention Month. And then we also made a video that highlighted every single 988 sign that we knew of in Norwalk to really highlight, if you see them around town, this is what it is and why it is so important. Thank you. It's a really, let me stop sharing. It's a really great opportunity to be able to do this work. And so thank you for letting me share that with you guys today. Frank.
How big was the grant?
Did Frank guess?
Oh, Ken, hold on a second. I think Frank had his hands up. I think
I'm
Frank
sorry.
and then Ken.
Sorry, Frank.
Just a comment. Child abuse and neglect are mandatorily reported by healthcare providers. If a physician sees a patient that has been child abused or neglected and doesn't report it, they are guilty of malpractice. Why isn't there any effort made to do the same thing with this issue? And that is, if a healthcare provider sees a patient and suspects that they're suicidal, there should be some reporting chain mandated, just like child abuse and neglect.
Yeah, yes, ideally it would. I think that's something I am learning, is that it is not the same policy-wise for each healthcare provider or clinician. And we're starting to learn about a lot of discomfort or lack of practice in the conversations around asking about suicide, which is what I think is motivating us to really continue to build that relationship with our healthcare providers on how can we continue to train clinicians on having those conversations. How can we, and that's really the Zero Suicide Initiative that we held as that starting point, right? It's how can we help streamline that every clinician in Norwalk screens every patient at intake for suicide risk and knows the resources to then get that transition of care. And so hoping one day we can get there where everybody has that idea that, if someone says I'm struggling with, thoughts of suicide, it's this is what we do, and this is how we move forward. But yeah, it's definitely, not mandated, which makes it hard.
Thanks, Frank. Thanks, Kelly. Ken, did you have a question?
No, I'm all set.
Okay. All right. Thank you so much, Kelly. You and the team are doing phenomenal work.
Yeah, absolutely.
Great. Last we have Brian, who's going to give us his EPI updates. Good morning, Brian.
Hey, good morning, Deanna. Good morning, board. Good morning, everybody. It'll be short and sweet, so this kind of worked out nice. What's not nice is the reason why it's short and sweet. So just pulling up the CDC community snapshot for respiratory viruses. Long and short of it, I'm zoomed in Connecticut, but the catch is this data is up to date as of about last month now, September 26, and that's because the publicly available data has been impacted by the federal shutdown. So this is just for our edification, our own knowledge in terms of the circumstances. So where things were left off again, this was presented at our last meeting in terms of kind of where we're at. But, we were seeing the respiratory viruses picking up. So that's COVID, flu, and RSV. COVID-19 wasn't that very high in the, wastewater activity level. So kind of, again, what we've kind of unfortunately have been seeing is par for the course with the weather. Same thing here with the NREVSS dashboard, September 26th, last update date. But at that time, we had rhinovirus and enteroviruses, experiencing that, pretty decent uptick, in terms of pretty decent activity too, compared especially 2024. SARS-CoV-2 at that time was, dropping a little bit, but we can anticipate it's picking up. Looking at more local wastewater monitoring, which actually still is getting up to date as of, this part of this month. We are seeing RSV has entered locally in the picture. We are still seeing norovirus. So it's just kind of other things they want to keep in mind, along with the COVID and the influenza activity slowly picking up, as, kind of, especially as we approach Halloween too, right? So that's, T-minus 3 days. That's another big social gathering that also kind of helps contribute to further spread. And so that's something else, we just got to keep in mind. So again, going back to our standard kind of, again, guidance here, I'll just go over really quickly because we've heard it a million times. Immunizations, respiratory and hand hygiene, cleaner air filtration, the appropriate air filtration too, flu and other antivirals where appropriate. And then staying home and preventing the spread. So that's waiting till your symptoms are better and you're fever-free without any fever-reducing medications for 24 hours. Then taking those additional precautions with the masking, the distancing, especially not going to events with a large number of people around. And then testing oneself. I mean, again, we've heard this a million times, but this is very relevant for us to kind of stave off, any sort of onrush or onslaught of, respiratory virus, uptick. So as best as we can, right? Again, not only here locally, but also, nationally and internationally too. Then to that point, just kind of doing an update relative to our drought conditions. This is from our extreme heat and drought monitoring hub for Norwalk. Just scrolling straight down here, just a reminder about conserving water. This data was last updated Thursday, October 23rd. So we should get our new update Thursday. But right now it still had, Fairfield County in that moderate drought conditions, part of it, along with abnormally dry for, the majority of it. Still, we get qualified in that class 2, which is the state classification system. So we are still experiencing that drought. We'll see what the new update kind of yields on Thursday, but it's something just to keep in mind, conserving water indoors, outdoors, fixing leaks, things of that nature. Just, applying that common sense relative to that. So without further ado, that's pretty much it, in the main front of things without taking any more time. Thanks, everybody.
Thanks, Brian. Great highlights. Thanks for sticking on the whole meeting to share that. Does anybody have any questions for Brian? All right, hearing none. I'd like to adjourn the meeting if there isn't anything else. I know we're over like 16 minutes and we typically are. Anything else before we wrap up? Great. Thank you, board. Thanks for being engaged. Thanks to the staff for all the great presentations and the board for the great discussion and questions. And it's a great meeting today. Thank you.
Thanks,
care.
everybody.
Thank you,
All right,
Deanna.
see you next month. Bye.